Welcome to today's Explainer. Today, we're jumping right into some incredibly practical, science-backed strategies for managing your blood lipids. We're going to explore the real mechanics of your cardiovascular system and unpack biological strategies that are highly effective. And the best part? We're doing this without any impossible, punishing lifestyle overhauls.
Okay, let's dive into this. To truly take control, we first need to understand exactly what we're up against. When we talk about an artery blockage, I think a lot of people just picture a physical clog of fat, kind of like grease stuck in a kitchen pipe. But biologically, it is so much more volatile than that. It is literally an inflamed, ticking time bomb waiting to explode right inside the artery. It's a highly active, dangerous mechanism, and we need to actively diffuse it.
So, here is our roadmap for today. 1. The ticking time bomb inside the artery. 2. The fiber trap and Mediterranean fats. 3. Biological brooms and sustained movement. 4. The magic of 10% weight loss. 5. Stopping structural damage. And finally, 6. Biological cement and strict medication adherence.
All right, starting with part 1, the ticking time bomb inside the artery. When a blood test comes back, it is so easy to just look at those numbers on the paper and feel totally disconnected. But atherosclerosis, the buildup of these inflammatory plaques, is a life-or-death biological mechanism. It's not just a set of numbers. If we frame this simply as boring medical mandates forced upon us, we completely miss the bigger picture. Instead, let's view this as an opportunity for strategic biological management. That puts the ultimate control right back in your hands as the architect of your own health.
Let's move to and see how this builds into part 2, the fiber trap and Mediterranean fats.
Let's completely bust the myth that heart health means you have to eat tasteless, deprived meals. The Mediterranean diet is a nutritional pyramid that lets you genuinely enjoy your food while directly attacking high triglycerides. Here's how it works. Vegetables and whole grains form your reliable daily base. Red meat and sweets? Well, we treat those as rare monthly celebrations rather than everyday staples. But the real mechanical advantage kicks in with healthy fats, like olive oil, and getting omega-3s from fatty fish like salmon or sardines twice a week. These healthy fats go in and directly combat the dangerous fats in your bloodstream. And right alongside those fats, we have what I love to call the fiber trap. When you eat soluble fibers, think oats, legumes, or just a simple apple, they act as a literal physical trap inside your gut. They actually catch the bad cholesterol and expel it right out of your body before it even gets a chance to enter your bloodstream. It's basically like having a microscopic security guard at the door of your circulatory system, stopping the intruders before they can cause trouble.
Moving on to part 3, biological brooms and sustained movement.
Now, what's really interesting about this slide is how it completely redefines HDL. You've probably always heard it called good cholesterol, right? But honestly, that sounds a bit too passive. Instead, I want you to picture HDL as highly active, microscopic biological brooms. They aren't just passively floating around in there. They work tirelessly to actively sweep up and clear out all those accumulated triglycerides from your blood vessels. They are your internal cleaning crew, and keeping them on shift is an absolute priority.
So how do we keep that cleaning crew working? Well, there's a huge myth out there that protecting your heart requires short, utterly exhausting, intense workouts. Actually, scratch that. Biologically speaking, intense exhaustion just makes your biological brooms appear suddenly, and then they disappear just as fast the second you stop. The reality is that gentle, sustained, moderate activity is vastly superior. It keeps those biological brooms sweeping continuously, clearing out your arteries smoothly without burning you out. And guess what? All it takes to keep this entire system optimized is the number 150. Yep, just 150 minutes of moderate activity per week. That could literally be as simple as a brisk, enjoyable walk. That is the magic number to keep your internal cleaning system running sustainably and effectively week after week. All right, part 4, the magic of 10% weight loss. So the crucial point is, you absolutely do not need to lose half your body weight to see massive biological improvements. Losing just 5 to 10% of your total body weight is entirely enough to trigger an immediate, profound metabolic recovery. The incredible benefits kick in long before you ever reach what a chart might call your ideal weight. We really need to remove that heavy psychological pressure. To really visualize this magic, Imagine a 100-kilogram person who loses just 10 kilograms. Look at the biological chain reaction that instantly happens inside their bloodstream. First, the blood practically clears itself of floating triglycerides. Second, those stubborn, dangerous LDL cholesterol particles actually begin to break down. And third, your body cells open their doors to accept sugar, which drastically improves your insulin sensitivity. It is profound, internal magic happening all from just a 10% change. Which brings us to a very urgent part 5, stopping structural damage and artery destruction. We need to talk about the critical danger of mixing high cholesterol with tobacco use. Smoking isn't just a lung issue, it is a direct, violent assault on your cardiovascular system. Tobacco toxins violently smash against the delicate inner lining of your arteries. This trauma creates microscopic cracks and horrifying structural damage in the artery wall. And what happens to those cracks? They become perfect, dangerous traps for cholesterol to catch onto, build up, and form life-threatening clots. It rapidly accelerates that ticking time bomb we talked about earlier. And to make matters even worse, smoking completely eliminates your biological brooms, your HDL. It literally takes your active cleaning crew right off the clock, leaving your arteries entirely defenseless against that plaque buildup. So stopping smoking is the absolute fastest, most impactful way to stop that structural damage in its tracks and let your biological brooms return to protect you. Finally, let's look at part 6, biological cement and strict medication adherence. And this brilliantly illustrates the true, unseen purpose of medications like statins. So many people think statins are just there to artificially lower a number on a lab test, but their hidden mechanical superpower is actually cooling down the highly dangerous inflammation raging around the plaque. They are quite literally the firefighters putting out the arterial fires that make that time bomb so volatile in the first place. This is especially vital for folks with genetic predispositions where lifestyle changes alone just aren't quite enough. Once that inflammation is cooled down by the medication, your body does something absolutely amazing. It builds biological cement. This is a thick, incredibly strong, fibrous layer that your body constructs directly over the cooled plaque. It permanently stabilizes that dangerous buildup, locking the ticking time bomb securely into the artery wall so it physically cannot rupture and explode. But here is the catch. If daily medication doses are skipped, that inflammation is instantly reignited. When the fire comes back, it physically weakens and melts away the biological cement your body worked so hard to build, exposing the ticking time bomb all over again. Strict daily adherence isn't just following a recommendation from your doctor. It is a daily, life-or-death necessity to maintain that protective cement. Which leaves us with this final, truly provocative question to ponder. We've seen the mechanics today, and we know the strategies. The power to architect your own cardiovascular health is entirely in your hands. So ask yourself today, will your daily habits build dangerous structural traps in your arteries, or will they build solid, life-saving biological cement? The choice is absolutely yours. Thanks for joining this explainer.